Okay, let's start po.
Magandang hapon po muli, mga classmate, sa ating masipag na doktor, kay Dr. Hector. So, ipagpapatuloy po natin ang ating topic, types of chi. Number 7 na po tayo. So, yan po yung illustration na, no? Pamilyar na siguro yung ibang patuloy na nakikinig at nanonood. Uulitin lang po natin na yung food, pag kinain natin, ito ay nagpo-produce ng food chi. Then, yung lungs, yung hinihinga nating hangin, ay yun po yung air chi. Pag nag-combine po yan po yung nagiging gathering chi. Tapos, yung original chi po natin na nakaimbak sa ating kidney, magko-combine po doon, magiging true chi. Then, yung true chi po, dyan nang gagaling yung nutritive chi na dinidistribute sa ating mga organs. Yun po yung nagiging lakas natin. Tapos yung defensive chi po na dinidistribute din po ng ating lungs para sa protection natin. So yung pure components po, yun, ito po yung illustration na yung food. Pag kinain natin, pumunta sa stomach, then doon po magsisimula yung digestion. Tapos yung mga impurities na pag-aralan na natin na pupunta po yan sa small intestine, then sa large intestine at ilalabas natin. The spleen transformation. Parang ganyan po yung ng drawing. So yung food chi po or yung good chi, ito po yung chi of grains. Yun na nga po yung galing sa food, yung nagiging chi. So yung first stage in transformation of food into chi. So food on entering stomach is first rooted and ripe, then transformed into food chi by spleen. This food chi is not yet in form that the body can use. From middle burner, food chi rises to chest and goes to lungs, where combining with air, it form gathering chi or yung zong chi. Ayun po yung kanina nating ina-explain. From middle burner, food chi also rises to chest and goes first to lungs, then to heart, where it is transformed into blood. This transformation is helped by kidney chi and original chi. So yun na po yung kanya. Food chi is produced by spleen. Important function of transformation and transporting various products extracted from food. In so doing, spleen has to send food chi up to chest. One reason why spleen chi ascend. Kaya yung energy po ng spleen ay pataas. Pag bumaba po siya, spleen chi normally flows up. It flows down. Food is not transformed properly and there will be loose stool. Yun. Pag humina ang chi natin, nagkakaroon tayo ng pagtatae. Pababa. So, stomach function in Chinese medicine na ripen foods and controls digestion with the spleen. Yun po yung function ng stomach. So, siya din yung namamahala sa ating mouth. Manifest on lips. Stomach is the origin of fluids. Kasi di ba pag uminom tayo, dun muna pupunta yung mga fluids na pinapasok natin sa ating katawan. Stomach and spleen. So yung energy ng stomach, chi ay descend, while spleen, chi is ascend. So pag nanghina po yan, pag nagpataas, nagsusuka. Pag nanghina ang spleen chi, magpababa, magtatae. So ang stomach chi ay mas po siya sa prone sa heat and dryness. Yun yung nag-a-affect sa stomach. So pag nagkakaroon ng problem, nagkakaroon ng stomach rebels and gets excess more. Yung pwede pong pag nag-hit ang ating stomach, pwede tayong nagsusuka, tapos yun nga minsan mabaho yung hininga. Yung pag na-expose o sobrang mainit ang ating stomach. While spleen chi naman, prone po siya sa cold and damp. Mas affected po siya pag may cold and damp environment tayo. So yung spleen po magsisink and gets deficiency more. Yun, nagiging ganun po yung pakiramdam natin, mabigat na pakiramdam, mahina pag ang ating spleen chi ay humina. Although food chi represent crucial first stage in transformation of food into chi. This coarse form of qi cannot be used by the body as it is. It is therefore its basis for transformation into more refined forms of qi. So pag kumain tayo, kailangan mo nang i-digest ng ating spleen para maging energy ng katawan. Since food qi is extracted from food and is basis for production of all qi and blood, it is easy to see what importance Chinese medicine attribute to quantity and quality of food eaten. Kaya napakahalaga po nung kinakain natin. Huwag tayong basta-basta kumain ng hindi mga healthy food. Ay ngayon pong panahon na ngayon napakaraming kung ano ng pagkain na hindi healthy. Kaya napakaraming may karamdaman dahil ang pinagsisimulan po talaga nito kung ano yung pinapasok natin sa ating katawan na dumadaan sa ating stomach. So yung clinical note po, to tonify food qi or yung good qi, so gumamit po tayo ng Ren 12 and stomach 36 o Susan Lee. So food qi or yung good qi, ito po ay originates from stomach and spleen. So doon nagsisimula. It is the origin of qi and blood. It rises to the chest where the lungs, it combines with air to form gathering qi or zong qi. It rises to the chest where in the heart, it is transformed into blood. So yun po yung cycle. Pag nagkaroon po tayo ng spleen qi deficiency, yan, pakiramdam po natin ay bloated after meals. Tapos nagkakaroon tayo ng loose stools at madali rin tayong mapagod. So titingnan po natin yan sa ating katawan or sa ating mga pasyente. Pag may mga ganyang sign, spleen qi deficiency, mahina po yung qi. At pag spleen qi sinking naman po, bearing down sensation. At yung mga organ prolapse, halimbawa yung loose-loss, ano pa yung may term po sa Tagalog na yung parang lumalabas yung puwerta. Ano na nga yun, Dok? Anong term yun? May ganun po akong naging pasyente na parang hindi talaga lumalabas po talaga yung may lumalabas sa puwerta niya. So, isang example po yun ng spleen qi sinking. The same diagnosis, spleen qi deficiency. Pag spleen niyang deficiency naman po, dahil mababa yung init, ang nararamdaman po ay cold body and limbs. Madali siyang lamigin. Tapos yung may undigested food po sa kanyang dumi. Yan. Pag spleen not holding blood, kasi responsible po ang spleen para hindi tayo magkaroon ng mga pasapasa at saka hindi lumalabas yung dugo sa ating katawan. Or halimbawa po yung lumalabas sa ilong yung dugo, sa ngipin, yan. Heavy menses po, isang sign niya na spleen not holding blood. Madali ring mapagod, tapos yung dumudugo yung mga gilagid, bleeding gums. Sign po yan na may problem ang spleen sa pag-hold ng blood sa ating katawan. Thank you po.
Thank you, Ma'am Mildred. Punta na tayo ngayon sa tongue diagnosis. And let's listen to Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Now let's talk about, welcome po sa tongue diagnosis. Now let's talk about the continuation of our topic yesterday, tongue spirit and tongue body color. The red tongue is redder than the normal, although traditionally 2 shades are described, red or dark. The clinical significance of these 2 is essentially the same. Okay? A red tongue always indicates heat, which may be full or empty. Therefore, when we observe a red tongue, the first thing we should ask ourselves is whether it has a coating or not. If the tongue is red with a coating, with root, whatever its color, it indicates full heat. If the tongue is red without a coating or is coated and partially not, or with a rootless coating, whatever its color, it indicates empty heat. So, ito po ang kaibahan ng full heat at ang empty heat. Wherein full heat, the tongue is red with a coating and with root, while empty heat, tongue is red without coating or is coated and partially not or with a rootless coating. Okay? So ito po ang itsura ng red tongue body color. It should be stressed that a red tongue without a coating indicates specifically empty heat rather than yin deficiency. Although obviously it arises from the latter, or empty heat arises from yin deficiency. In other words, it is the lack of coating that indicates the yin deficiency and the redness without coating that indicates empty heat. The implication of this, of course, is that there are many tongue types that indicate yin deficiency if the tongue body is not red. So, ito po ang kaibahan ng yin deficiency at empty heat. In yin deficiency, the tongue body color is normal, but it lacks or lacking in or no coating. In empty heat, the tongue body color is red without coating. Okay? So the tongue body may be red in specific areas, especially the tip, the front third, the center, or the sides. A red tip of the tongue indicates heart heat, which may be full or empty. If the tip only is red, it indicates that the condition of the heart heat is slight. Whereas, if the whole tongue is red and the tip is redder, it indicates that there is generalized heat and severe heat. Okay, so to summarize, red tongue with coating indicates full heat. Red tongue without coating indicates empty heat. Normal tongue without coating indicates yin deficiency. Okay? Red tip. Ito pang itsura ng tongue with red tip, which indicates heart heat. This shows the difference between the heart blood and liver blood, wherein heart blood anchors the mind or shen, while the liver blood anchors the ethereal soul or un. Okay? Red sides all along the edge indicate liver heat, whereas a redness of the sides only in the central section indicates either stomach heat or spleen heat. If the tongue is red in the center, it indicates stomach heat. If it is red in the front third, including the tip, it indicates lung heat. Okay? So this is an illustration of liver heats, wherein the whole size of the tongue is red. Okay? And this is also liver heat because the red sides are red. And this is spleen heat. The size of the central portion only is red. And this is stomach heat. The center portion only of the tongue is red. Okay? And this is lung heat because the whole anterior third is red. So it is considered as lung heat. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Let's now go to diagnosis by interrogation featuring feeling of cold. Okay. Today, we will talk about wind cold and wind heat. Factors determining the development of wind cold or wind heat. The constitution of a person is the main factor which determines whether a person who falls prey to an invasion of wind develops wind cold or wind heat. Were it not so, in cold northern countries, nobody should fall prey to invasions of wind heat, which is not the case. This is also the reason why in children, invasions of wind heat are more prevalent than wind cold, because children are naturally young in nature compared sa mga adults. There are also new artificial factors which may predispose a person to invasions of wind heat when succumbing to wind. Very dry, centrally heated places, hard working conditions, like mga cooks, metal workers, no? Next, we go to clinical manifestations. Although a fever is more likely to occur in wind heat invasion, the differentiation between wind heat and wind cold is not made on the basis of intensity of aversion to cold and fever or a hot feeling of the body. Other factors, such as the tongue and other symptoms, will help differentiate between wind cold and wind heat. No? So, in wind cold, the wind cold obstructs the space between skin muscles. So wind heat obstructs the space between the skin and muscles and impairs the descending of lung qi. Now let's go to symptoms and signs. The fever in wind cold is slight, while it is high in wind heat. Yung shiver sa wind cold is more pronounced compared sa wind heat. The aches are more pronounced in wind cold, slight po sa wind heat. Walang thirst ang wind cold, may thirst sa wind heat. The urine is clear sa wind cold, slightly dark pag wind heat. Okay. The headache in wind cold is occipital in location, while sa wind heat, it is deep inside and severe. Okay, sweating. Sa wind cold, if sweating, it is in the top part, the head, whereas in wind heat, slight sweating lang. Sore throat, the throat is itchy in wind cold, and the throat is very sore in wind heat. No change in the tongue pag wind cold. Pag wind heat, slightly red on the sides and or the front. The pulse in wind cold is floating tight, so wind heat floating rapid. So treatment for wind cold, we use pungent, warm herbs to cause sweating. While in wind heat, we use pungent cool herbs to release the exterior. Thank you very much. Next, we go to pulse diagnosis. Let's listen again to Ma'am Mildred. Good afternoon po ulit, Ma'am Mildred. She will continue left, the heart pulse. Sige po.
Left front position, heart 2. Left front position, heart. Pag weak po, a weak position on heart pulse often indicates a functional weakness of the heart and circulation rather than emotional problem. So yung functional po yung may problem pag yung position sa heart pulse ang mahina. Although the two conditions may of course occur simultaneously, thus a weak pulse on the left front position often indicates heart qi, heart yang, or heart blood deficiency. And the patient would suffer from cold hand, tiredness, slight restlessness, slight depression, and palpitations. If the heart position is very weak, but the other pulses are not weak, and there is a heart crack on the tongue, the sign indicates a constitutional weakness of the heart. Yung mismong puso po yung may problem noon. So letter D is floating. A pulse that is floating in one position only is not so floating as the floating pulse seen in external invasion of wind. So pag floating po ay invasion of wind. Nasa labas pa lang. When the pulse is floating only in one position, that is not the lung position, it does not indicate an exterior invasion of wind, but rather a pathology of that particular organ. In mild invasion of external wind, the pulse may be floating only on the lung position. A floating quality on the heart pulse often indicates a problem with the heart itself. For example, a floating hollow quality felt on the lateral and medial side of the pulse position may indicate high blood pressure. A floating weak hollow quality indicates that the heart is dilated. This occurs often in the people who jog for long distance every day. A floating tight, hollow quality may indicate hardening of the arteries. So napakahalaga po pala nun, no? Talagang dapat i-practice yung pulse. Slippery. A slippery quality on the heart position, especially on its medial and lateral side, often indicates heart disease. In such a case, the pulse on the heart position is often deep, fine, and slippery. Pag hollow naman po, kung ang buong pulso daw is hollow, it of course indicates loss of blood. But the significance is different if only the heart position is hollow. In such a case, it usually denotes that the heart is permanently dilated or enlarged. Yung paghalo ang pulse sa heart. Often from excessive jogging. If the pulse feels hollow and overflowing with strength on the distal or proximal side of the heart position, it may indicate anterior sclerosis and or high blood pressure. So kahit wala pong pang-BP, pwede nating malaman paano pag alam natin i-pulse. Okay po. Pag choppy pulse naman po, a choppy quality on the heart position indicates heart blood deficiency, often deriving from emotional problems such as sadness. If both the heart and liver position are choppy, it indicates general deficiency of blood, kulang ng dugo, which may derive from other than emotional causes such as overwork or childbirth. Yung sobrang pagod at saka maraming ipinanganak, nagkakaroon ng choppy pulse. So, pag wiry naman po, a wiry quality on the heart position usually indicates stagnation in the chest. Tandaan po natin, pag wiry ay may stagnation. If the pulse is wiry and strong, it indicates stagnation of chi in the chest. Wiry and strong, chi po may problema. With the patient most probably suffering from chest pain. If it is wiry but fine and rapid, it may indicate that the heart has been affected by shock. If both the heart and lungs position are wiry with strength, it may indicate stagnation of chi in the chest, probably due to previous accident or blow to the chest. Pag left front position naman po, sa left ng heart, overflowing, ibig sabihin po nito ay may deep emotional problem or may chi revealing upwards. Pag short naman po, sadness or grief na apektuhan siya. Pag weak, functional weakness of the heart and circulation. Pag heart chi, weakness of the heart and circulation, heart chi, heart yang, or heart blood deficiency. Yun po yung ibig sabihin pag weak yung pulse. Pag floating naman po, possible na may heart problem or high blood pressure. So, floating hollow on lateral medial side. Pwede raw pong heart dilated. Pag floating weak hollow, tumitigas yung mga arteries. Pag floating tight hollow, slippery, pag slippery naman po ang nakapa natin sa pulse ng heart, mayroon siyang heart disease. So, slippery on median and lateral side. Pag hollow po, heart dilated. Usually from excessive jogging, hardening of arteries, na stroke or high blood pressure. Ang pulse po niya ay hollow overflowing. Pag choppy po, heart blood deficiency. Usually from sadness, yung mga sobrang nalulungkot. Pag wiry naman po, ay may stagnation po ng chi sa ating dibdib or na-shock. So, ang pulse po niya ay wiry, fine, rapid pag may accident sa ating chest, halimbawa na bunggo. Both heart and lungs positions wiry. Thank you po.
Thank you very much, Ma'am Mildred. At least kahit papano may alam na tayo sa heart pulse. Next.
Ang ganda rin, Doc, na talagang masanay tayo sa pagpapulse. Sanay tayo sa tang plus pulse. Ang ganda po ng mga makikita po natin, ano.
Oo, we just
Kailangan constant practice.
kailangan lang talaga pulsuhan mo parati. Ang technique pala niyan, unahin mo check yung pulse ng heart. Diba? So let's start with the heart pulse, then followed by the liver, so on. Thank you po, Ma'am Mildred. Next, punta na tayo ngayon sa differential diagnosis, and let's call on Ma'am Neats. Good afternoon po, Ma'am Neats.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc? Mahina?
Lalakasan mo lang. Okay.
Lakasan ko na lang.
Thank you.
Wala akong ano ngayon eh. So, our topic for today in our TCM Foundations 182 is liver blood deficiency engendering the wind. Okay. So, as we know, if there is liver blood deficiency, especially if the condition lasts a long time without being treated, the blood vessels become empty and the space is taken over by internal wind. Like an empty building will often get a lot of wind in its corridors. The concept here is the same. Okay? This kind of wind is less severe compared to the one caused by internal fire. Patients typically get tremors, same for all internal wind patterns, but in this case, they are less important. The typical manifestations for liver wind are tremor, tic, numbness or tingling, dizziness, convulsions, or paralysis. So, while the typical symptom of liver blood deficiency are blurred vision, poor memory, scanty period, insomnia, and etc. others. So, liver wind agitating internally due to liver blood deficiency can derive from the following. Yung diet, kasi yung spleen, yung responsible for making blood, and if the spleen is weakened due to poor diet in nutrition or it lacks blood in generating the food. So, yung mga food na yun, katulad ng red meat or grains. So, nagkakaroon ng less blood for the liver. And then, nagkakaroon ng liver blood deficiency. Kapag hindi nagamot, nagkakaroon na ng internal liver wind. Okay? Isa pa ring cause yung emotional stress. Alam na naman natin na yan. Kapag matagal na yung emotional stress such as sadness and grief can consume liver blood directly. So, these emotions may first harm the chi, which then result in poor blood formation. Both actions cause liver blood deficiency. If not treated for some years, it leads to internal liver wind. Okay? Isang cause pa rin yung physical overexertion, yung sobra exercise. Kala natin okay yung pag-exercise, pero kapag nasobrahan, nakaka-harm ng spleen yang. So, as a result, yung function ng spleen na pag-transform and transport is ng food ay naapektuhan, and then less blood can be generated and stored in the liver. Okay? So, excessive exercise also injures the sinews, since the liver controls, moistens, and nourishes the sinews, which in long run can give rise to liver blood. It can agitate the internal liver wind and become the internal liver wind. Okay? So, Ang etiology ng liver blood deficiency engendering wind, ayun nga, as we said, diet, poor in nourishment or lacking in protein, blood loss, excessive physical work, chronic illnesses, too much sexual activity. So, underlying accompanying pathology, chronic deficiency of liver blood. So, possible presenting conditions, yung fright wind or yung tinatawag na convulsion sa mga bata. Sign and symptoms, fine tremor, facial tic, dizziness, blurred vision, numbness and tingling of limbs, poor memory, insomnia, light penetration. Okay? Kapag tiningnan yung pulse, it can be wiry or fine. Okay? Yung tang naman, pag tiningnan mo ay pale at saka payat. Okay? So, kapag ka nagkaroon tayo ng ganitong patient, treatment principle, nourish blood and extinguish the wind. So, acupuncture points treatment, liver 2 and liver 3, calms the liver, extinguish the wind. Spleen 6, regulates the liver, nourishes the blood. GB20 or gallbladder 20, Pengchi, extinguishes interior wind. Li4, eliminates wind from the face. SJ5 or triple warmer 5, extinguishes the wind, benefits the head. DU19, GV on governing vessel 19, eliminates the wind, calms the tremors. REN4, nourishes the blood, use moxa. Okay? Bladder 20, PSU or chronic infantile fright wind, yung convulsion. Kapag meron yan, lagyan mo ng bladder 20. DU20 or GV20 extinguishes interior wind. Liver 8 nourishes the liver blood. Bladder 18 nourishes the blood. Kidney 3 enriches kidney to nourish the blood. And bladder 17 used with moxa nourishes the liver blood. Okay? Thank you very much, everyone.
Thank you very much, Ma'am Needs. Punta na po tayo ngayon sa acupuncture patterns and practice. And let's listen again to Ma'am Teresita Sumile. Good afternoon po ulit, Ma'am Teresita.
Good afternoon po, Dr. Hector, and good afternoon din po sa lahat. Acupuncture patterns practice. Palpitations 2. This is the continuation of the lecture of Sir Dino yesterday. Key points of analysis. The causes of palpitation are complex, and its differential diagnosis is therefore also complex. Broadly speaking, the following are key. First, differentiate between strength and deficiency of the illness. In palpitation due to deficiency state, differentiate between deficiency of qi and blood of the zhang organs and that of yin or yin-yang. In strength type of palpitations, differentiate between phlegm, rheum, blood stasis, and fire. Palpitations most commonly occur in deficiency state, but the symptoms often show a mixture of deficiency and strength. Hence, in diagnosis, attention may be paid to both and to their relative degrees. Okay? The degree of deficiency of the genuine is affected by the degree of injury to the visceral organs. In general, if only one visceral organ is involved, the palpitation tends to be mild, whereas if several visceral organs are involved, it tends to be severe. The visceral organs are interrelated through several types of interactions. Heart illnesses can induce impairment or injury of the other Zhang Fu organs. Similarly, Illnesses of other organs can directly or indirectly affect the heart. In ordinary circumstances, if palpitation is due to only the heart itself being diseased, it tends to be mild with few mixed symptoms. Clinically, the main symptoms are limited to palpitations, anxiety, chest tightness, and insomnia. But if other organs are involved, then additional symptoms become apparent. For example, if kidney yang is or kidney yin is deficient, there may be such additional symptoms as aching pains in the waist, yin deficiency cold, impotence, polyuria, cold limbs with cold aversion, and hotness in the palms and soles. If liver fire is active or liver yin deficient, there may be dizziness, tinnitus, blurred vision, a bitter taste in the mouth, agitation, and flank pains. If the spleen is insufficient, there may be nausea, epigastric distension, fatigue, weakness, and a white and greasy tongue coating. In these more complex situations, the condition is more severe. Okay? Acupuncture treatment. The principal acupoints to select are bladder 15, bladder 14, REN 17, CV14, heart 7, and PC6. Now, if fire blazes in yin deficiency, add kidney 3 and spleen 6. If phlegm fire moves internally, add CV12 and stomach 40. If there is blockage by retained water, add CV12, spleen 9, and stomach 36. If there are shortness of breath and wheezing in addition to palpitation, add bladder 13, lung 5, and lung 9. If there is edema, add CV9, spleen 9, and spleen 6. In general, apply the reinforcing method. Moxibustion may be added. Okay? Now we have case study. The patient was an adult female. She had palpitation with chest tightness and shortness of breath for over a year. At the time of admission to hospital, she felt tightness and pressure in her chest and precordial pain. Any physical activity precipitated palpitation with panic and shortness of breath, alleviated by sighing. For about a month, she also had mild fever and 3 episodes of heavy menstruation within the month. The tongue was red and purple, with a thin coating, and the pulse was rapid, at the rate of 160 beats per minute. The heart was slightly enlarged, with the point of maximal impulse in the fifth intercostal space and 1 centimeter lateral of the nipple line. On auscultation, there was a grade 2 to 3 systolic murmur over the apex. The electrocardiogram showed an inverted T wave in all leads, indicating strain of the heart muscle. Diagnosis: palpitation due to deficiency of both Qi and Yin, resulting in disharmony among the vessels, stasis of heart blood, and failure of nourishment for the heart. Therapeutic principle: replenish Qi and Yin mobilize blood and harmonize the vessel and calm the heart and the mind. Case study number 2. The patient was an adult male with a medical history of palpitations, accompanied by a sensation of chest pressure and tightness. During an attack, she also had panic restlessness and a dry and sticky mouth. The tongue coating was yellow and sticky, and the pulse was thread-like, rapid but irregular. Auscultation of the heart confirmed an irregular heart rhythm with an overall rate of 200 beats per minute. The electrocardiogram showed supraventricular tachycardia. Diagnosis: palpitations due to phlegm distributing the heart and causing panic. I'm sorry, palpitation due to phlegm disturbing the heart and causing panic. Therapeutic principle: purge fire, dissipate phlegm, and calm the heart and the mind. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Let's now go to signs and symptoms. And for this afternoon, our topic is itchy tongue and painful tongue. Okay. Sa itchy tongue, your first consideration would be the patient has heart fire. So itchy tip or front of the tongue, plus burning sensation of the tongue, and dyan yung palpitations, thirst, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste. The tongue is red with redder tip and yellow coating. The pulse is overflowing and rapid. Another consideration for itchy tongue is heartin deficiency with empty heat. So there is only a slight itching of the tongue, especially in the evening. Dry mouth and throat, palpitations, insomnia, dream disturbed sleep, poor memory, anxiety, madaling magulat, propensity to be startled, mental restlessness, uneasiness, feeling hot and bothered, thirst with a desire to sip fluids, a feeling of heat in the evening, malar flush, night sweating, 5 palm heat, and the tongue is red, redder on the tip, no coating, floating empty, and rapid ang pulse. Another consideration for itchy tongue, especially if your patient is an elderly male, would be heart and kidney deficiency. No? Okay. You look for palpitations, insomnia, dream disturbed sleep, anxiety, poor memory, dizziness, tinnitus, hardness of hearing, lower backache, night sweating, scanty dark urine. The tongue is normal in color but without coating. The pulse is floating empty. Then we have, for itchy tongue, you may also want to consider invasion of wind heat. No? So the tongue is itchy with acute onset, plus may aversion to cold, fever, cough, sore throat, stuffed or runny nose with yellow discharge, headache, body ache, slight sweating, slight thirst, swollen tonsils. The tongue is slightly red on the sides in the chest area or on the front part, and the pulse is floating and rapid. Then we go to the painful tongue. So yung first natin na consideration would be heart fire. Okay, so the tongue is painful, especially on the tip. Tongue ulcers, palpitations, stirs, mouth and tongue. Mouth ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste, No? Always remember bitter taste for heart fire or liver fire. Red tongue with redder tip and yellow coating, the pulse is overflowing and rapid. Next, you can also consider pag may painful tongue, heart yin deficiency with empty heat. The pain of the tongue is slight, especially in the evening. Dry mouth and throat, palpitations, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, mental restlessness, uneasiness, feeling hot and bothered, dry mouth and throat, thirst with a desire lang to sip fluids, feeling of heat in the evening, malar flush, night sweating, 5-pound heat, tongue is red, redder on the tip, no coating. Pulse is floating, empty, and rapid. Okay, you may also want to consider for painful tongue, stomach fire. Okay, look for bleeding gums, foul breath, intense thirst, with desire to drink cold liquids, burning epigastric pain, mental restlessness, dry mouth, mouth ulcers, dry stools, sour regurgitation, nausea, vomiting soon after eating, a feeling of heat. The tongue is red with a thick, dry, dark yellow coating. The pulse is deep, full, and rapid. You can also consider for painful tongue, stomach deficiency with empty heat. So the pain is just light, dull or burning epigastric pain, feeling of heat in the afternoon. So the patient will tell you bakit parang mainit pagdating ng hapon. Dry mouth and throat, especially in the afternoon. Thirst with a desire to drink in small sips, dry stools, slight feeling of fullness after eating, night sweating, 5-pound heat, bleeding gums, red tongue or red center only without coating in the center, floating empty, and rapid pulse. Now, for painful tongue, you may also want to consider liver fire. Meron ding thirst plus bitter taste, may headache, red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, constipation, dark urine. The tongue is red with redder sides and dry yellow coating, wiry, rapid pulse. And lastly, for painful tongue, you consider phlegm fire harassing the heart. So, meron pong thirst, bitter taste, kasi may fire, sputum in the throat, palpitations, mental restlessness, red face, a feeling of oppression of the chest, expectoration of phlegm, insomnia, dream disturbed sleep, agitation, mental confusion, incoherent speech, no? Rash behavior, uncontrolled laughter or crying, shouting, depression, manic behavior, red tongue with redder swollen tip, may heart crack with a sticky dry yellow coating inside it, and the pulse is slippery rapid or slippery overflowing and rapid. Thank you very much po. We now come to our last but not the least. And
Hello,
we,
Doc. Doc, may naalala lang ako dito sa itchitang ano po, di ba uso ngayon ang marites? Pag may itchitang, heart fire, si marites siguro po ganun ano. Joke lang po.
oo. Si
Malaking
Marites,
dila.
oo. Yeah, ano lang talaga, bored lang sa buhay. Kaya kailangan magkaroon ng color.
Opo.
Maraming salamat. Okay, punta na tayo sa last topic. Still on asthma, let's ask the kindness of Ma'am Mildred to give the presentation. Okay,
Yes
so
po.
ito na po yung slides.
Asthma. Late onset non-allergic asthma. Another phenomenon that points to wind rather than phlegm as the main pathogenic factor in asthma is the remarkable effectiveness of acupuncture in stopping an acute asthma attack. This is because wind is an unsubstantial pathogenic factor and, as such, more responsive to acupuncture treatment. When phlegm is the main pathogenic factor, as in chronic bronchitis, acupuncture has only limited efficacy in relieving breathlessness in the short term, as it obviously takes a long time to resolve phlegm. Another interesting detail that points to wind as the main pathogenic factor in allergic asthma is that asthma attacks are often preceded by itching on the neck kasi may wind kaya may itching, and or upper back. Itching is often due to wind. Even more so when it is confined to the upper part of the body. So basta't may itchy talaga po, tandaan natin wind. Wind. Another modern Chinese doctor, Dr. He Shuahai, maintains, as I do, that the main pathogenic factor in asthma is not phlegm, but wind. Doctor He says that allergic asthma is due to the invasion of allergens, and he compares this with the Chinese concept of wind. Interestingly, in contrast to most other modern Chinese doctors, Dr. He understands the correlation between allergic rhinitis and allergic asthma as being two manifestation of the same disease. He says that when allergens settle in the nose, they cause allergic rhinitis. So pag pumasok sa ilong, allergic rhinitis. Tapos yun, hahatching at makati ang ilong. And when they settle in the bronchi, yun ang nagiging cause ng allergic asthma. So yung pagkakaiba po ano. Dr. Wu Xinghe also says that if it's so, the nature of allergic asthma reflects the characteristic of wind coming and going quickly and having rapid onset. Moreover, Dr. He also thinks, as I do, that the bronchospasm that causes narrowing of the airways in asthma is also manifestation of wind, as wind contracts. Wind as the main pathogenic factor in asthma. Wind contracts, it comes and goes, and boots, and it causes spasm. Wind is the main pathogenic factor in asthma, not in the sense of an invasion of external wind, but as kind of chronic external wind locked in the bronchi. The Chinese idea of wind may be compared with the Western concept of allergens. The inhalation of dust, fecal matters from house dust mites, pollen, and animal danger could be compared with invasion of wind as conceived in Chinese medicine. Allergic asthma is due to wind in the bronchi causing periodic bouts of wheezing. Asthma attacks are often preceded by itching of the neck and or upper back. Itching is often due to wind. Even more so when it's confined to upper part of the body. So pag may wind, lagi talagang may itching. As for the late onset asthma, although this is usually not allergic, its pathology is similar, with the root being the deficiency of lungs and kidney, but the manifestation being phlegm in the lungs. The etiology is different because the kidney deficiency is induced by overwork, excessive sexual activity, and natural decline of kidney qi in the middle age, rather than being congenital. Thus, the kidneys are affected not from birth, by itself, by lifestyle. Many patients with late onset asthma, especially men, often find the condition worse after sexual activity. In late onset asthma, a spleen deficiency caused by irregular diet is often present. In this account for the presence of phlegm, which manifests with swollen tongue. Late onset asthma is also characterized by a more frequent involvement of liver. So yun, pati yung liver na apektuhan. pag mayroong mga emotional stress, at in the pathogenesis of the condition. So yung may mga ganun po, ina-asthma pag namumroblema. So involve yung liver. Comparison between early onset and late onset asthma. Pag early onset allergic intrinsic asthma, ang root po niya ay deficiency of lungs and kidney defensive chi system. So pag late onset ng allergic intrinsic asthma, ang root po nito ay deficiency of lungs, spleen, and kidney. Yung tatlong organ ang involved. Ang manifestation po ng early onset allergic intrinsic asthma ay WIN. Ang etiology niya ay congenital, ang pattern ay none. So pag late onset naman po, ang manifestation ay phlegm. Yun ang pagkakaiba niya. Pag early onset, WIN. Pag late is phlegm. Ang etiology, overwork, excessive sexual activity, irregular diet, old age. So, ang patterns ay liver pattern often involved. So, yun po yung pagkakaiba niya. Thank you.
Maraming salamat po, Ma'am Mildred. So with that, we would like to thank everyone for joining. And sana hindi po tayo magsawa. Okay, so see you po later. Hopefully, you can all attend. Thank you very much sa mga presenters. Thank you for joining. And see you again po tomorrow.
Thank you po.
Evening po. Bye-bye.